Do you think something's wrong with you or you lost your touch? Sexual arousal disorders is an underrecognized and undertreated disease that can go unnoticed in many trifling relationships. The National Health and Social Life Survey found that 32% of women and 15% of men lacked sexual interest for several months within the last year. These habits can be very overseen and unrecognized as an arousal disorder. And we're here to help you guide through the questions and bring back that spark to the bedroom. Female arousal disorder is defined as a persistent or recurrent inability to attain sexual arousal or to maintain arousal until the completion of a sexual activity. This can occur in certain sexual situations or in all sexual situations. These responses involves a complex interplay of physiology, emotions, experiences, beliefs, lifestyles, and relationships. Disruptions of any of these components can affect sexual desire, arousal, or satisfaction. And normally treatment involves more than one approach. Typical causes for female arousal disorder are either physical, hormonal, or psychological, or a mix of all three. For physical causes, a number of medical conditions such as cancer, kidney failure, multiple sclerosis, heart disease, and bladder problems can lead to a sexual dysfunction. Medications such as antidepressants, blood pressure, antihistamines, and chemotherapy drugs also decrease your sexual desire and your body's ability to experience orgasm. Low estrogen levels after menopause leads to genital tissues and sexual responsiveness changes. This decrease in estrogen leads to a decreased blood flow in the pelvic region, which also results in the needing more time to build arousal and reach orgasm, as well as less genital sensation, leading to the arousal dysfunction. Psychological and social problems can also lead to sexual dysfunction. Untreated anxiety or depression can lead to long-term stress and history of sexual abuse. Worries of pregnancy and demands of being a new mother can also have similar effects on sexuality. Regardless of the causes, the treatments are either medical or non-medical. The most common non-medical treatment would be counseling. We're talking with a counselor or therapist specializing in sexual and relationship problems can help. Other than that, healthy living style habits and lubricant can also be simple changes in your life to help. When it comes to medical treatment, adjustments and changes in medications because of side effects are something you should talk to your doctor about. Thyroid problems, depression, and anxiety are also things we can treat to help your sexual desires. And then there's male erectile disorder, which is defined as the inability to keep or get an erection firm enough for sex. This dysfunction is an ongoing issue and it can cause stress, affect your self-confidence, and contribute to relationship problems. This can be a sign of underlying health conditions, and sometimes treating an underlying condition is enough to reverse the erectile dysfunction. Male sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and blood vessels. Any minor physical condition that slows any of these responses can cause male erectile dysfunction. Typical physical causes could be heart disease, high blood pressure, high cholesterol, diabetes, obesity, metabolic syndrome, multiple sclerosis, tobacco use, alcoholism, and sleeping disorders. When it comes to psychological, the brain plays a key role in triggering a series of physical events causing an erection. Depression, anxiety, or other mental health conditions, stress, relationship problems, poor communications, or concerns can all lead to these damaging causes. Treatment for male erectile disorder are also medical and non-medical. Typical oral pills that enhances the effects of nitric oxide, which is a natural chemical that produces and relaxes muscles in the penis, can increase blood flow and allows you to get an erection. Possible side effects are flushing, nasal congestion, headache, visual changes, backache, and stomach upset. Another common treatment would be the use of a penis pump. This creates a vacuum that pulls blood into your penis, which causes an erection for sex. And yet again, talking to someone, a counselor, therapist, and psychological evaluations can help in your sexual dysfunction. Being aware of these arousal disorders and treating them are very imperative in keeping the disorders at low levels, and by treating it, you'll look like this in no time.